Welcome back to PureLifePulse, your compass, to navigate the world of wellness and vibrant living. Imagine planning that dream vacation, picturing sun-drenched beaches or exotic landscapes. Excitement bubbles. Itineraries are crafted, but have you considered the tiny, almost invisible threat that could derail your adventure? We're talking about malaria, a mosquito-borne disease that remains a significant health concern in many parts of our beautiful world. For those of us in the USA, UK, and Canada, where malaria isn't a daily worry, it's easy to overlook, when planning international travel. But understanding how to prevent and treat malaria is crucial for a healthy and joyful journey. Today, we're diving deep into practical, evidence-based strategies to protect yourself and your loved ones, ensuring your travel memories are filled with wonder, not worry. Malaria, at its heart, is a parasitic infection spread through the bite of infected Anopheles mosquitoes. While it's not a concern in our home countries, venturing into regions of Africa, South America, and parts of Asia and Oceania means entering areas where malaria is present. The good news is, with the right knowledge and preparation, malaria is largely preventable and treatable. Prevention truly begins before you even pack your bags. Think of mosquito bite avoidance as your first line of defense. This isn't just about swatting away buzzing pests, it's about creating a shield. Insect repellents containing DEET are highly effective and should be applied to exposed skin, especially during dawn and dusk when mosquitoes are most active. Imagine DEET as your personal force field against these tiny intruders. Clothing choices also play a vital role. Long sleeves and trousers, especially in light colors, minimize skin exposure, acting like a physical barrier. Consider treating your clothing with permethrin, an insecticide that provides an extra layer of protection, turning your clothes into mosquito deterrents. And when it's time to rest, particularly in less urbanized areas, sleep under insecticide-treated bed nets. These nets are like personal cocoons, safeguarding you while you sleep. Beyond bite prevention, preventative medications, often called antimalarials, are a powerful tool, especially for higher-risk destinations. Think of these medications as preparing your body's internal defenses in advance. There are various types of antimalarial drugs, and the best choice depends on your destination, health history, and personal circumstances. This is where a pre-travel consultation with your healthcare provider becomes essential. They can provide personalized advice, prescribing the most suitable medication and dosage for your trip. Don't see this as a mere formality, but as a crucial step in tailoring your health strategy to your travel plans. Despite the best prevention efforts, breakthrough infections can occur. Recognizing malaria symptoms and seeking prompt treatment is therefore vital. Symptoms often mimic the flu, fever, chills, sweats, headaches, muscle aches, and fatigue. If you experience these symptoms during or after travel to a malaria-prone area, think malaria possibility and seek medical attention immediately. Early diagnosis, usually through a blood test, is key to effective treatment. Malaria treatment is generally very effective, especially when started promptly. Treatment options vary depending on the type of malaria, its severity, and drug resistance patterns in the region where you were infected. Your healthcare provider will determine the most appropriate course of action, often involving antimalarial medications to clear the parasite from your system. Now, let's talk about vaccines. While for many years malaria vaccines were, a distant hope, scientific progress has brought us closer to this reality. As of now, there are malaria vaccines being rolled out particularly for children in malaria-endemic regions. For travelers from the USA, UK, and Canada, the situation is still evolving. Vaccines are not yet universally recommended for all travelers, and their availability and specific recommendations can vary. Think of malaria vaccines as an additional layer of protection, particularly beneficial for long-term residents or frequent travelers to high-risk areas. Keep an eye on the evolving recommendations from health organizations like the CDC and WHO, and discuss vaccine options with your healthcare provider during your pre-travel consultation. They will have the most up-to-date information and can advise you based on your individual risk profile. It's worth noting that malaria isn't a single entity. Different types of malaria parasites exist, with varying levels of severity and drug resistance. Plasmodium falciparum is the most dangerous type, prevalent in many parts of Africa and responsible for most malaria deaths globally. Understanding the specific types of malaria in your destination can further inform your prevention and awareness. Drug resistance is also an evolving challenge in malaria management. In some regions, malaria parasites have become resistant to certain antimalarial drugs, highlighting the importance of staying informed about current resistance patterns and adhering to prescribed medications correctly. Think of drug resistance as malaria parasites adapting to overcome our defenses, making our vigilance and informed choices even more critical. Beyond medications and bite prevention, consider your accommodation choices when traveling in malaria-prone areas. Air-conditioned rooms and accommodations with screens on windows and doors offer enhanced protection against mosquitoes indoors. Simple actions like closing doors and windows at dusk can also significantly reduce mosquito entry. Traveling to new places enriches our lives, broadens our horizons, and creates lasting memories. By taking proactive steps to prevent malaria, you're not just protecting your health, you're ensuring that your adventures remain joyful and uninterrupted. We at PureLifePulse are committed to empowering you with the knowledge to live your healthiest, most vibrant life, wherever your journey takes you. Do you have your own travel health tips or experiences with malaria prevention? Share them in the comments below. Let's build a supportive community, exchanging insights and encouraging each other on our paths to wellness. And remember, this information is for educational purposes and not a substitute for professional medical advice. Always consult with your healthcare provider or a travel health clinic before any international trip to discuss your specific malaria risk and create a personalized prevention and treatment plan. Stay informed, stay healthy, and keep exploring the world with PureLifePulse.